Vital sign measurements are a crucial aspect of clinical assessment, screening for potential red flags and to guide treatment of patients. Vital signs are indicators of a patient's health conditions, and normal measurements usually provide assurance of good health. Vital signs consist of temperature, pulse rate, blood pressure, and respiratory rate. Sometimes, parameters such as blood oxygen saturation and pain may be added as vital signs. Apart from ill health, vital signs can also be influenced by a number of factors such as age, time, gender, medication, and environment. Vital signs are typically measured when the healthcare provider encounters the patient for the first time. Patients who are ill, like those in hospital wards, need their vital signs measured every few hours. Some severely ill patients, like those in the intensive care unit, are attached to machines that monitor their vital signs continuously. Vital signs are often measured when the patient is receiving medications and also before, during, and after medical procedures.